Hi everybody, it's Dana. I haven't posted anything for a minute, so I'll try to make this brief and not too long. But I did want to tell everybody about what happened at MD Anderson in Houston and why I went there and not Emory or Duke. It was a place that was recommended to me by 3 doctors, and I don't know how much I should say about Emory, but I just know that the specialty and the rate for what it is that I have is better there. It's a very, very, very large place with a lot of people, and a lot of people that are probably worse off than I am, so there's a lot of patients involved in my day-to-day stuff. It's best to memorize your medical record number when you get there. Fun tip. So I'm going to talk about my meeting with the neurosurgeon. I talked already about my meeting with the neuro-oncologist, neurologist, Dr. Yelp. So this is actually about Dr. Boots, who was the neurosurgeon I met with on Wednesday. Tuesday I had what was called a 3 Tesla MRI. That is twice as many Teslas as most MRIs. Most MRIs are 1.5 Tesla. This one was a 3 Tesla. I think it was installed there at about like 2005-ish. So fairly new, a little bit higher resolution, nicer picture, it's prettier smile. It's weird to see your tongue, like you totally see like the outline of your tongue in these. Meeting with Dr. Boots. He's called Dr. Boots because he has amazing cowboy boots. Dude lives in Houston. Overall, I really liked him. So this thing that I have is in a busy location. Most neurosurgeons are pretty sure that it's a glioma. Neurologists and neuro-oncologists don't want to necessarily say what it is. So Dr. Boots is pretty sure it's a low-grade glioma. He thinks it has the appearances of a tumor. Where is it located? It's located in the inferior portion of my frontal lobe. He thinks it's near my olfactory nerve, so I might be having funky smells. Might be smelling cat litter differently than normal. It's also near my hypothalamus and pituitary gland. There goes Joel rubbing against my computer. And near an anterior cerebral blood vessel. 3 Tesla MRI that I had done was really, really intense. If you're ever going to go through that, just know it might take a whole day for you to recover just from all the contrast and nutso-ness. They sound really cool when you're in them, but then they can be quite draining, especially if you had to forego any medication to fall asleep or relax yourself. So, since it is in this sort of busy area near a blood vessel, near this olfactory or possible optical nerve from another doctor, near the pituitary gland, near the hypothalamus, they can't do a typical little needle biopsy. They'd have to do what's called a craniotomy, where they cut you open, kind of near your hairline, and they go in and they take it out. And Wikipedia says they'd have to replace it with a metal plate, but I don't know. I don't know if that's true. I'll be totally Cylon, but I feel like a craniotomy isn't necessarily Cylon technology. So I'm kind of torn. Because I want to be a Cylon, but I want Cylon technology employed. It's really scary to think about somebody going in and cutting open your head. So, there's that. What are you going to do? I still don't have a meeting with them yet. I have to wait until Dr. Yelp is back from vacation. Next week he went on Dr. Spring Break. Dr. Boots and Dr. Yelp are going to talk after looking at the second MRI. Overall, this kind of makes me weak to talk about, which is why I haven't talked about it to many people or publicly. I don't know what to say. Chris found a podcast on what it is that I have on low-grade level 2 gliomas, and I'll post a link to that on this channel so you can listen along. Stuff that I might not have mentioned about my my symptoms. I get in this really weird childlike state whenever I have an episode or seizure. It's sometimes triggered by being in a hospital. Sometimes it's triggered by a super loud noise, like a nurse shutting a locker right near your head, or a nurse shutting a door in your face so she can talk to another nurse and laugh. Yes, both are things that have happened to me that have triggered an episode. It's really fun to be in and out of hospitals. I also have trouble multitasking. I have trouble with transactions. Going to the pharmacy, saying thank you, saying please. Not all the time. Mostly when it's time for another dose of medicine. I went out to an event last night and I had trouble ordering a water. And I think somebody thought I was joking around. And that was hard. Because I joke around a lot. And when we were first telling people about it, there were people that thought we were joking around. We're not. I'll post some pictures of my MRI. It's the most expensive headshot you can get. This thing looks like it's spread to the left side of my brain a little bit. Looking at some of the pictures. It's sort of right in the middle. So here on the right side, kind of about here. And then almost a little bit of it down the middle. And it really does look like a beam. So I'm going to try to post video after this and hopefully that'll work. Hope you guys are doing well.
Check out this guy, he's gonna minority report my brain. These were scans that were done in Atlanta and I filmed with an iPhone. Whoa, my face, totally my face. Can you see that German nose? That's totally my face. Where's my hair? I don't know. Look at those millimeters, it's the metric system. Doctors use the metric system even though we don't. There's my bean, pinto bean, ba-da-ba, ba-da-ba. My salon head is right there, da-da-da, da-da-da. Floating circle.